Good morning, everyone. This is Carly Houchin from the Kansas Health Institute. A couple of quick items before we get started. Just want to let everyone know that our live stream is going now, and you should be able to see the agenda for our meeting today on my screen now, but we'll get started in just a few.
Good morning, Carly.
Good morning, Representative Landwehr. How are you this morning?
I'm doing good. Are we the only ones on here right now?
No, so far it looks like Sandra's on, Spence might be in the process of joining, and then a couple other staff.
Okay, I can't always see that when I'm on my phone, so.
Very good.
I'm kind of excited for the meetings Thursday and Friday.
Good. I feel like it's definitely been, lots of hard work over the past couple of months. So I'm excited to see what the special committee has to say about everything.
Well, and to see this all come to.
Oh, you might be muted
like
there.
It's a puzzle, so. Could you hear that phone ring a second ago?
I did not.
Okay, good.
I think maybe we have a couple of others in the. Go ahead. I'm just going to give the quick reminders again. This is Carly Houchin from the Kansas Health Institute. Just want to let everyone know as you're in the process of joining, you should be seeing our agenda for the call today on our screen, and want to let you know that our live stream has started as well. Good morning, everyone. This is Carly Houchin from the Kansas Health Institute. I think we have folks still in the process of joining, but I show 11 o'clock, so I'm going to go ahead and get us started on our agenda for the day. First, welcome to the System Capacity and Transformation Working Group meeting. I believe this will actually be the last meeting for this group, so I want to thank you all in advance for your hard work today and over the past couple of months as well. You should be seeing the agenda for our call this morning on our screen now. I can provide a brief overview of that in just a moment, but want to first turn it over to Jenna from the Revisor's Office for a brief statement on open meetings.
All right. Thank you, Carly. Due to health and safety concerns, members of the public are not in attendance at this meeting of the Special Committee on Mental Health Modernization and Reform Working Group on System Capacity and Transformation, but full access to this meeting is being conducted by medium of interactive communication, allowing members of the public without cost to listen to the meeting through use of live stream audio broadcasting on the internet and teleconferencing as available. This video can be accessed on the YouTube webpage by searching for the Kansas Health Institute or KHI live channel. The agenda and all documents for this meeting have been provided by the Kansas Health Institute. Additionally, a link to these documents can be found in the comments section of the YouTube video previously referenced. Each working group and staff member shall state their name and title each time the individual begins speaking or voting so that the individual can be readily identified by remote listeners. All participants are required to ensure that microphones, phones, or other electronic devices are muted when they are not speaking so that the ability of remote listeners or observers to hear the proceedings is not unnecessarily impeded. Public comment will not be allowed at this meeting. During this meeting, the committee will not recess to a closed or executive meeting pursuant to KSA 75-4319 and amendments thereto. And lastly, each motion, if any, will be clearly stated before the working group votes, and the chairperson will announce the results of the final vote. That's it for me.
Very good, thank you. So this is Carly Houchin again from the Kansas Health Institute. I'll take us into the rest of our agenda then. So we'll get started with introductions in just a moment, and then our primary purpose, our main objective for the meeting today is to review and ratify the draft working group report. That is available at the link listed at the top of the agenda on the screen here. There's a PDF version of that working draft, and what we'll plan to do in the first portion of our meeting today is go through that, particularly the sections regarding the topics that have been assigned to this working group, and make sure there are not any other either clarifying or corrective edits to the recommendations and related rationale presented there. Then as far as next steps, those recommendations, that working group product will be presented to the Special Committee on Mental Health Modernization and Reform across Thursday and Friday of this week. So our second objective for our meeting today will be to plan the presentation of the working group product to the Special Committee. So I'll say more about that when we get to that portion of the agenda, excuse me. But at the highest level, what we'll plan to do is we'll have the working group co-chairs provide a brief overview of a given topic and the recommendations related to that topic. Approximately, a brief 10-minute overview of the 4 or 5 recommendations and related visioning discussion summaries in each of those topics. And then from there, the special committee members will likely ask questions related to each recommendation. So what we'll plan to do in the later part of our meeting today is run through each recommendation and make sure we have a working group volunteer to kind of take initial questions there. So that we have someone ready to speak and there's no wasted time there, and we'll allow people to gather some thoughts in advance if they're interested to do so. Okay, so that's where we're going today. We'll jump in just a moment, but first want to run through some introductions so that we all know who is on the line. With that, I believe the first person I'm seeing is Andrea.
Good morning, Andrea Clark with the Behavioral Health Services Commission at KDADS.
Very good. And then I see Representative Landwehr.
Brenda Landwehr, State Rep, Wichita.
Next, I see Representative Shu.
Representative Ray Shu, House District 25, Northeast Johnson County.
Then I see Sandra.
Good morning, Sandra Berg with United Healthcare.
And then I see, I think, Spence.
Hi, Spence Cohen, Court Services Specialist with the Office of Judicial Administration.
Very good. I think that's all I'm seeing at this point. I heard from a couple of folks this morning. They had something pulled them away at the last minute, so they might be joining a few minutes late. So hopefully we will see a few more group members as our meeting progresses here. But without further ado, I will take us into our first agenda item for the day, which will be review of the working group report. So let me get that screen share started here. If I can find it on my screen. There we go. Okay, so what you should be seeing now is a draft version of the working group product. This should look very similar to the Word version of the document posted with meeting materials that was disseminated last week. And what we'll do here is we'll just run through a few of the high points as it pertains to the work that was kind of designated to this group. And again, we're looking to make any clarifying or corrective edits so that we can present the recommendations and the related rationale to the special committee in a way that's as clear as possible. So the first section of the report that I have on the screen here is just kind of the front matter, the report overview. I will just pause briefly to see if anyone had kind of overarching comments on the report overview as far as if there was anything missing or if there was something that was unclear that we should spend some time addressing. So I'll pose that question first. And then additionally, within the report overview, there were a couple of pieces that I wanted to draw your attention to. The first of which is the box on the right-hand side of the screen here, which is a definition of the behavioral health and the behavioral health system. I think this was, the meetings run together a bit, but it was either a meeting of this working group or it could have been in the special committee format as well, where we heard interest to include a definition of behavioral health in the product, just to ensure that everyone is clear about what we mean when we refer to behavioral health. So this recommendation here was something that was briefly adapted, or there's small modifications from a definition provided by SAMHSA. And then we heard from the state, from KDADS, that this aligned with some of their thinking around the topic, as well as the state mental health agency. Any comments or questions on that definition?
Carly, this is Sandra at United, and I wonder if it would be beneficial to kind of do a little bit of a summary on the rubric that we used and how we scored them, so that people know that we took into consideration what would need policy changes, legislative action, that type of thing.
Sure, yeah. You're saying in the report overview?
Yes.
Okay. So I think where we currently have that, and I'll say the bias that we had in putting this report together was to try and keep the report overview as short as possible. Just thinking that with the level of complexity, things can get lost pretty easily. Where we have some of that information now, Sandra, is in the introduction.
Okay.
Let me take you to that. So we have a brief little bit here on working group process. Apologies for the fast scrolling here. This little diagram breaking out kind of when all of the different topics were addressed by each group. And then we have the recommendation rubric included as an appendix to your point, illustrate kind of a bit more of the process and some of the values that the working groups were weighing through in scoring and arriving at these priorities.
Okay, thank you.
That being said, if there are pieces of that we should specifically include in the report overview as well, we can definitely make some of those modifications.
I would leave that up to Representative Landwehr as to what she feels like the committee would need as far as those elements. But I think if we include it in the introduction, that's good.
Okay.
And Sandra, I follow where you're going, and I think it's important that we, clarify wherever we see it's necessary in order for future individuals, whether it's legislators or even folks in different areas from our working group, 2 years from now, to understand why we took the path that we've taken. So you've got a very good point.
Very good. So this is Carly at KHI, and a couple of other things that I'll flag here in the report overview section. There's a brief little bit to Representative Landwehr's point on navigating the report, just wanting to make it clear to future readers who are more disconnected from the process. as to kind of how the group was thinking about some of these different elements, and how they can move through the body of the report in terms of some sense making there. But the next maybe substantive piece that would be helpful for this group to spend some time discussing is some of the visioning statements. So I'll put those related to the topics assigned to this group on the screen here now. So if you'll recall, throughout some of this special committee roundtable discussions, and then pieces of it in the working group meetings as well, we've worked to articulate a vision for modernization related to the 10 topics that had been assigned out to each of these groups. So we really think is the recommendations as the roadmap to change, but the vision statements here are intended to be the brief snapshot of kind of what a modernized system looks like related to each of the topics defined here. So as a reminder, the 3 topics assigned to this group that you've spent time talking about in your meetings were data systems, interactions with the legal system and law enforcement, as well as system transformation. So I'll give the group a minute to look at those, but if there are any, again, clarifying edits or corrective edits, I'm happy to make any of those changes here.
Brenda Landwehr here, didn't we, in one of the other working groups, as we've talked about data, and we know there's a lot of data, but it seems like that working group came up with some wording to clarify. I don't think the word used was meaningful, but I think it was was it traceable, trackable, or
so this is Carly at KHI. Representative Landwehr, your audio is breaking up for me a little bit there. I think I caught maybe the first part, which was about the group that the working group that went through their portions of the report on Friday of last week, had some comments about how we represent the importance of data, kind of driving how decisions are made in the modernized behavioral health system. So I'll flag for the group, one specific place we made a change for them was as it relates to funding and accessibility. They highlighted the importance of relying on measurable outcomes to drive decisions. So that was one change that we made there. So I don't know if there are any places related to any of these 3 topics where we should make it more explicit the role that data will play in a modernized system. While folks maybe
I think the issue was.
Go ahead.
Okay, because for some reason I lost my connection too, so I hope this is better. I think that we wanted to get away from, and you're talking about the right group last week, is it just being, and I think maybe it was Will Carpenter that came up with the terminology, but we just need to go back at that report and look, so we don't just say data or that it's going to be trackable. It's like it's got to be realistic and measurable and monitorable, because the problem that the state has, it has always had, is there's a lot of data, but if we don't put it in a working, usable format, it's irrelevant to us. And what happens is, so many times we're having to ask, well, do we have this data? Then someone goes, looks, they find it, then they got to take the time to format it. So I think it's going to be important, anything that we do in this system, that we have a format that is laid out, and we pick the high level data that we feel is important to monitor all the time, to make sure that we are actually doing good. And then there's this outside data of that formula that we can dive in deeper when we need to. Does that make sense what I'm saying?
Mm-hmm. So this is Carla at KHI. I think two things are coming to mind. One, Representative Landwehr, one possible change. I wonder if there is language that you would propose we add to data systems, the data systems kind of visioning statement here, if that statement or something about maybe the value of having measurable outcomes from the behavioral health system is something that we would look to a modernized data system to provide. And I feel like that was maybe one piece that I was hearing. There's another thought, but let me pause there and get feedback from working group members on that.
This is Sandra with United. I wasn't sure if Representative Landwehr was still speaking or not, but I think if we add the language around to support data-driven outcomes or something along that effect in that paragraph, it might cover what we're trying to say about outcomes.
See, I think, Carly, if we would go back and look at that meeting from last week, I think the language is going to be in that meeting. And I think that in all four of our working groups, where we can stay consistent with the terminology that we use will be very important. Because then people become very used to it, very familiar with it, and they all keep that kind of at the top of the mind. So I think we already have the language. It's just not coming to the top of my head from that meeting last week.
Yeah, so this is Carla at KHI with the group. Oh, sorry, go ahead there, Representative Landwehr.
Yeah, and I may not be putting it here in the right spot. I'm just saying somewhere we have to have that. Sure. And be consistent in all four of our working group reports. Okay.
Yeah. So I think the language from the group last week was specifically around measurable outcomes, is I believe where they landed. So I think we could incorporate the change Sandra suggested here with maybe using that language again from that the group last week landed on, if that's acceptable. So it would be like highlighting that one of the purposes of a modernized data system would be to support measurable outcomes.
And Carly, this is Sandra. We do mention it down in system transformation, rationally funded and outcome-oriented system. So it's mentioned down there. So I think we've covered it.
Very good. So
this is Andrea with KDADS. And as these are kind of vision statements, I don't know if it wouldn't be appropriate to have a phrase or to note when we're discussing data systems, something that also highlights, the importance of privacy and protected health information as part of a modern system, that our data systems collect information in a usable and helpful way, but we at the same time we're still holding that value that particularly substance use disorder information and mental health information, that there's a high standard for privacy.
Sure. So this is Carly at KHI. Andrea, would I hear that suggestion to be added specifically to the data systems recommendation, or is there another spot you see that piece living as well in some of these vision statements?
I think in the data systems bullet, and it doesn't have to be anything significant, a significant addition, but just noting at some point that's a value as well. And for that not to be lost in discussions about data, that having specifically if we're talking about having a state level system that's collaborating with lots of different partners and et cetera, that system is mindful of and can manage just the privacy needs federal confidentiality laws, et cetera, that can be pretty onerous.
Mm-hmm. Very good. So this is Carly at KHI. We'll make that addition as well. Maybe have two other questions here on these vision statements, and then I'll direct the group to the data profile for some kind of further conversation on the data and outcomes piece of this. So first, related to either data systems, legal system, and law enforcement or system transformation. Any other final comments from working group members as to changes we would like to see to some of these vision statements? Not hearing any. I also want to flag for the group that there's a vision statement included here related to the topic of telehealth, which, as a reminder, that topic was taken up by a subgroup with members from across the 3 working groups. So maybe specifically rely on those who participated in that subgroup conversation to take a quick look at this telehealth statement. I'll just pause here for a moment to see similarly if there's any edits the group would like to see to the vision statement related to telehealth.
Carly, Brenda Landwehr, if we're going to, I mean, technically, you guys are bringing in 4 different committee reports. So do we need to identify that telehealth is maybe addressed in more detail in the telehealth committee working group report?
So this is Carly at KHI. This is maybe a helpful clarification to provide. So all of the working group information will be in a single document from all 4 groups, just for ease of navigation. It's all in here together, and then like the reference at the end of each vision statement takes you to the page where the kind of detailed section on that topic begins. But it will all be in one document.
Right. No, and I understand that. So what you're telling me when I'm looking at here, page 48 will take you to the telehealth work groups report, correct? Okay, correct. All right, that's fine. You've already done it.
Yeah, and hopefully we'll have in the final version, hopefully we'll even have hyperlinks and everything like that so that you can just click through and jump directly there, since putting them all together does give us a pretty large product. But hopefully that's one thing we can do to make it easier to navigate.
Well, I think those are going to be very, very valuable for people trying to research on this stuff, because this is a huge report.
Mm-hmm. Very good.
I still haven't gotten through the last 2 mental health task force reports.
Just once you get a good group together to take on a topic this complex, it always feels like a shame to leave anything out.
Carly, this is Sandra with United, and I think, and I don't know, Andrea, if you think we need to reiterate the privacy piece in the telehealth. It was something that was in the recommendation language for the telehealth committee. And I remember there was quite a bit of discussion around that. So I don't know if we want to include that in the telehealth section as well.
This is Andrea with KDADS, and I guess it would be what is referenced later in the report. If I don't have a specific opinion as to whether or not to pull it out specifically under telehealth, although I don't think that it certainly doesn't hurt to emphasize it again, as long as it's addressed elsewhere.
Well, it may not hurt, Mrs. Brenda Landwehr, it may not hurt to have it mentioned in each one of our sections, because once again, repetition is what brings everything to the top of mind awareness. So, we're just talking not a paragraph, but, one-liners that we can put in there to get people, just to always be conscious of that being an issue to pay attention to.
Very good. So this is Carly
Because
at KHI.
I can see different people. Yeah, okay, Carly, I can just see different people taking sections of this report, and if where we can have generic language for specific things such as what data means, privacy, then no matter what section you decide to dive into, that is always mentioned and at the top of the mind all the time.
Mm-hmm. Very good. So this is Carly at KHI. We'll add the kind of brief statement on privacy protection related to telehealth, and can do a quick scan of the other topics as well to see where that makes sense as an additional tag. In the interest of time here, I'll maybe move us on to the next section that I had flagged for this group to briefly consider. Throughout this process, we've talked about, the importance of measurable outcomes and the role of data in informing how modernization moves forward. So with those kind of conversations and like kind of a request in mind from the special committee, our team at KHI has worked with state agencies to summarize or to put together a brief data profile to include in this working group product. In addition to this data profile related to each recommendation, there's where applicable, there's a brief description of a measure that we might expect to be responsive to the change described in the recommendation. But at this point, I wanted to show you the draft version of the data profile, which is intended to be the kind of high level measures that will help us kind of understand the health of the behavioral health system. So these measures collectively speak to different parts of the complex system, but when taken as a whole, hopefully get to a place where you could make sense of kind of what's going well and what's not on a year-over-year basis. So there's a number of measures here, and again, these were put together with input from the state agencies as far as understanding what data are consistently available across the state. But would pause here to see if there are comments or questions from working group members as we, and again, this we're still in the process of gathering the final data, but this table will be populated in the final version of the report. But we'll pause here for comments on any of these measures here included in the data profile.
Carly, this is Andrea with KDADS. And oh, looks like you're doing what I was just going to ask, which I was going to ask if you could scroll down a bit.
For sure. Just a combination of both process and outcome measures. As far as responsiveness to change, always think it's important to have options related to both of those. I'll eliminate our margins here so we can see as many as possible. So some of those outcome measures there, and then some of the,
when it says,
go ahead.
Okay, so, and maybe it was up there on a title, and just because of the scrolling, I can't see that, is that when it was, is it in the title what year we're looking at?
So the kind of first column here is current year, previous year, and then US as a reference point, current year and previous year. We don't have it in the title only because the most recent year of data is a little bit different depending on the data source. So then that's referenced parenthetically. The data year is what you're looking at in the parentheses next to each value as well. Any other questions or comments looking at the data profile?
This is Andrea Clark with KDADS, and I noted, just looking at the measures, is that they definitely, there really isn't much look at substance use as a measure or as a topic, and you know, that's with the definition of behavioral health, including SUD. You know, didn't know if that might also be an important piece of the snapshot of the behavioral health system, specifically around, you know, the page you're on right now has uninsured rates, for example. Maybe those accessing services without insurance.
Yeah, so this is Carly at KHI. Thanks for raising that, Andrea. I suspect, going back to our conversation previously, with that population, privacy is always a particular concern, just given the difficulty in sometimes finding that population. So if there isn't a specific suggestion of a measure that you're aware of, that would be super helpful. I think you raised an important question, but I think we would maybe need to rely on the expertise of those on the call to identify what might be a good option there.
This is Andrea with KDADS again, and there are several measures I think you could look at that are national survey measures that include both Kansas and national snapshots. So just as you're kind of looking at these measures here, the NSDA, NSDUH would be a good source potentially for SUD measures.
Great, thank you. That's super helpful. Comments from others?
Carly, this is Sandra with United, and I'm trying to read quickly through the data profile introduction. Does it say anything that the following tables are just a fragment of the system? Because I think, you know, what Andrea was saying about we left out substance use, but I think we kind of need to look at this table with caution, because it doesn't truly represent the whole behavioral health system and where the needs are.
That's really helpful. So looking at adding something to the data profile introduction that recognizes this is a piece of a very large and complex picture. There's many other measures available, and we should keep asking questions if we're kind of not arriving where we think we should be, something to that effect.
Yep, perfect. Thank you.
Okay.
This is Representative Elizabeth Bishop, and in terms of the data profiles, is there any part of the report, for instance, and especially this area, that will reflect the impact of the pandemic on mental health, or does that not come into view, so to speak, for another year or two, because most data gathering lags, excuse me. So I don't know to what effect we want to reflect that, because maybe it's just too early.
Mm-hmm. So Representative Bishop, this is, nope, I muted myself. This is Carly Houchin at the Kansas Health Institute. I think two thoughts on your question there. I think one option, we could add a note to the data profile as to, like to your point, when we would expect to see any changes in these data sources related to COVID and related impacts on the behavioral health system. Because to your point, I think many of the measures that we have here, based on when the data become available, we're likely not seeing many of those impacts yet. So one option, we could include that in the introduction to this data profile section. And then the other place where I think the impacts of COVID have really been incorporated in this report is in the telehealth section. I'm thinking specifically about some of the information that were provided by the supplemental experts that joined that subgroup discussion, as many of them had kind of recently done, surveys of providers and of users of those services. And so in that section, I think we see a number of places where COVID-19 has informed how those recommendations came together. And there was, pretty close to real-time data from those on that subgroup that informed how those came together. So those are the two items that come to mind based on your comments there, Representative Bishop.
Thank you, Carly. This is Representative Bishop again. I agree. I think that sounds like a good place to put it, basically flagging some areas for updating to take it, because I think we all recognize that it will have an impact and that it was something that we need to update on a regular basis as the newer data comes in.
Very good. Okay, so this is Carly at KCHI. The next thing that I'll have the group do is I'll move us down to the section of the report on the 3 topics from this working group, and we'll run through those one at a time to see if there are, again, kind of the 2 guiding things we're looking for is any clarifying or corrective edits. Not really looking to, relitigate any of the recommendations that have landed in here, but again, just wanting to make sure that we're presenting the information as clearly as possible to the special committee, and of course with no errors if we can avoid it. Okay, so the first topic assigned to this working group was data systems. So I'll run through the little tags of each of the recommendations included there just to refresh everyone's memory. But then we'll kind of take comments on any of them all at once. So the first recommendation related to data systems had to do with the state hospital EHR. Recommendation 7.2 then had to do with data and survey informed opt-out. 7.3 was a recommendation related to information sharing. Recommendation 7.4 had to do with a statewide needs assessment. And recommendation 7.5 had to do with cross-agency data. So again, we'll give folks a minute there, but looking for any clarifying or corrective edits across this data systems section.
Carly, this is Andrea. Can you tell me what page specifically is this in the report?
Yes. So page 35 is where recommendation 7.1, the table there lives. And it'll be the numbered page 35 rather than page there's some front matter that has Roman numeral numbering, but it'll be the page labeled page 35. So we can give folks a bit more time with this one. I didn't receive any edits related to these in advance of our call, so it may be that there are not any, which is also fine, but we'll maybe give it about 10 or 15 more seconds to see if there is if there are any comments we should incorporate. Okay, not hearing any, I'll move us to the next topic from this working group. So in the full report, we're on page 39 now, and it is the topic on the section on the topic interactions with legal system and law enforcement. So similarly, I'll run us through the recommendation kind of handle or topics here. So recommendation 8.1 has to do with correctional employees. Recommendation 8.2 has to do with support from this group for the recommendations from the Criminal Justice Reform Commission recommendation, or the recommendations rather from the Criminal Justice Reform Commission. 8.3 recommendation has to do with law enforcement referrals. And recommendation 8.4 has to do with the defining the crossover youth population. So again, we'll pause there to see if there are any clarifying or corrective edits in that section. Okay. And again, on this topic, I hadn't received any edits or comments in advance, so it may be that we don't have further changes to make here. The next topic, or rather the last topic assigned to this working group, was system transformation. So now we're on page 43 of the report, with the first recommendation then on page 44. So I'll run through these handles quickly again. Recommendation 9.1 had to do with a regional model. Recommendation 9.2 had to do with long-term care access and reform. Recommendation 9.3 had to do with integration. Recommendation 9.4 had to do with evidence-based practices. And recommendation 9.5 had to do with family psychotherapy. So again, I'm thinking about open to comments on any of the recommendations included in this section. Any clarifying or corrective edits that we should make.
Carly, this is Sandra with, sorry.
Oh, go ahead.
This is Sandra with United. I'm wondering on 9.1, it says ease of implementation cost would be a barrier to implementation. Do we want to say why we say that, or what the rationale is behind that?
Sure. Yeah, I think we can definitely make that change. If you could quickly toss out some language, that would be helpful for us just in terms of time saver.
I have to remember why we said it was going to be a cost. Yeah, I'm not sure why we said it was going to be a barrier. Andrea, isn't this intended to be part of the SIA and the movement towards IMD?
Well, I think this is, the regional model as discussed in the context of this working group, I think was about having SIA, State Institute alternatives, and specifically in the Wichita region. And I recall conversations we had about cost, about concern for cost for travel, but for people that have to go to either Osawatomie or Larned.
So this is Carly, KHI. If the group doesn't feel like this is that cost would be a barrier to implementation, we can also remove this as a note under our ease of implementation column if that's not reflective of
Carly, this is Representative Elizabeth Bishop. I think, excuse me, please, that the concern might be with some original startup costs in order to establish, for instance, an inpatient location here in South Central Kansas. I think that's something that could be shared with the community. I don't know to what extent, but I I believe that there would be cost savings over the long run and more efficient delivery of services.
This is Andrea with KDADS. And I mean, in thinking about this recommendation specifically, I guess I am unclear if in this context, if the regional model is if the recommendation is establishing a new regional state facility versus the model, for example, of the state contracting with existing facilities to provide certain levels of care to certain populations, if that like the State Institute alternative policy. And so I think that those, depending on which direction this recommendation is leaning, that would significantly impact, I think, this ease of implementation cost, if that makes
Sure.
sense.
So that would be something, this would be a great clarifying edit to make. Does the group have direction that they can provide us as to which of those two we were attempting to describe here? And I will note, so this was the recommendation, just to orient you as to where this discussion came from, is from the 2018 and also the 2019 Mental Health Task Force reports. There was a variety of recommendations related to this that this group combined into one here. So any guidance as to which of those two models Andrea described, we were attempting to direct folks to here.
Carly, this is Kyle, and I apologize, just got on moments ago. Is there a way for you to just describe in 15 words or less the two models?
Andrea, I'll let you take that one.
This is Andrea Clark with KDADS, and we started off, Kyle, by discussing this ease of implementation score, and how we mentioned that cost would be a barrier to implementation. And I asked for clarification if, when we're discussing like regional models for inpatient care, are we referring to establishing new regional state facilities as an alternative to OSH or Larned, or are we referring more to a regional model of the State Institute alternative policy kind of approach, where we're contracting with other private facility, the state's contracting with other facilities, for example, to provide this care in lieu of transferring somebody to a state facility.
Got it. You actually did a great job. That made complete sense in terms of what the two potential models would be. From a historical standpoint, having been on the two legislative mental health task forces groups, the conversation had really been about the former and setting up a either state facility or state contracted facility. So that's a little bit of a segue then to the second model. If you looked at contracting with someone either exclusively for beds that would be a regional model of OSH or Larned and putting it in the south central part of the state, it doesn't mean you would have to turn away non-involuntary admissions. The hope would be that we end up with voluntary admissions at all three facilities if you included the potential private one. So I kind of had, in my mind, that's sort of the model that I was thinking of, because we've got the State Institute alternative programs getting off the ground now. In fact, I think, Andrea, you may be involved with those, or I know Commissioner Brown is anyway, and then KDHE. So between the hospital diversion programs and the State Institute alternatives, state institution alternatives, it seems like that's something that's in progress now. So, I mean, as it relates to ease of implementation, I still think probably 7 or 8 is where that would be, just based on the funding allocation requirement, but the potential for high impact is probably even higher than an 8. But that's been, the conversation's been around for years. So I hope that was helpful.
So this is Carly at KHI. I'll look to the working group for direction. What would you have me add perhaps to our rationale to clarify for the reader which of the 2 directions we're intending to describe with this recommendation?
Well, this is Sandra with United, and I think that our ease of implementation statement kind of leads us, to me, it's still ambiguous. So if we're saying cost would be a barrier to implementing what, initial startup costs would be the primary concern to whatever model we're going, if it's model 1 or model 2 or a hybrid. I think that ease of implementation is a little ambiguous.
Sure. So we can definitely make a change to that language. Anyone have a suggestion as to how we would like to? Well, the first question is, do we think that, I think I heard Kyle say that cost would still be a barrier to implementation, just in terms of needing that allocation for that to move forward. I think I heard that, so correct me if that's an incorrect assumption. And then how can I describe that with more specificity to address your comment, Sandra?
Well, I think what you just said, summarizing what Kyle had stated about the allocation. So maybe adding something about that at the end of that, cost would be a barrier based on current allocations for funding, or something along that line.
So an appropriation would be needed.
Is that what you were saying, Kyle?
Yeah, something along those lines.
Okay.
Okay. I've made some changes on the screen. How are we doing? Do we need more there, Sandra, to get more specificity? Okay. I'll maybe open it back up then to comments across the recommendations in the system transformation section. Any other clarifying edits that the group would like to see at this point?
Is it too late to maybe move the potential for high impact up, or would you rather keep those where they are instead of opening that back up for conversation?
I think we can make a change. I can't think of a reason why that would be a problem. It would just make it more reflective, because we may have scored it and then made changes to the recommendation and not adjusted the recommendation scoring. So if the group is interested to make a change, I don't think that's a problem from my perspective.
And some of that is based even in the recent pieces, seeing our state hospital waiting list number go higher again in the last week. So I think potential for high impact could probably would be safe to be 9.
See nodding on that, so I've made that change on the screen unless there's any significant objection.
Thank you.
Carly, this is Representative Elizabeth Bishop again. I think that the explanation of the possibility of, for want of a better term, a hybrid system is exactly correct. I would also state that the need for appropriation is going to depend in large part on the potential for high impact, indicating the need for it and the actual result of cost savings. In other words, the cost benefit analysis would come out in favor of doing this.
Very good. Okay. So I'm not hearing any other comments related to the other 4 recommendations in this group. So in the interest of time, I'll move us on to our next item unless there is an objection. Okay. So as we briefly discussed earlier in the call, telehealth was a topic that was taken up by a subgroup with participants from each of the 3 working groups. So want to show those telehealth recommendations on the screen here. I will primarily ask for clarifying or corrective edits from those who participated in the subgroup. discussion, just so that we can be sure not to change the intent of that group at all throughout. So let me run through the topics related to those recommendations, and then again, can take comments wherever folks are interested to toss them out. So the first recommendation, 10.1, was related to quality assurance. Oh, and I guess I should say, to orient everyone, we're now on page 49 of the report with the first recommendation on page 50. The recommendation 10.2.
Carly, I'm sorry. This is Andrea with KDADS, and I'm sorry to interrupt and take a step back, but the recommendation on our previous topic around long-term care access and reform. Can you speak to the measuring impact bullet, percent number of certified CCBHCs in the state, and mobile response and stabilization services in regards to NFMHs?
So I might give that, let me send a message to Hina, who is the person on our staff who had conversations with the state agencies to arrive at all of these measures, so she could probably answer more detailed questions here. But I can say generally how we arrived at these is working with Commissioner Brown and others, and they just tossed out possible items that could be responsive, but if something is off base, that definitely could have been an error on our end. So let me shoot a message to Hina, and we'll see if she can hop on the call to address anything in more detail. Would that work, Andrea?
Yeah, just a point of reference, get the group's opinion on those, and the relevance of how those would this recommendation would be measured by those two bullets specifically. And I didn't also, I think part of any conversation around NFMHs and care as part of the continuum of care, really wanting to highlight kind of the discharge planning, the moving out of those facilities, as an important piece of a modern system, that NFMHs don't just become de facto permanent housing, I guess.
Sure.
This is Sandra, and I agree with what you're saying, Andrea. I think it's twofold. I think it is that discharge planning and transition, and making sure we have the supportive systems in place for when people transition out. But I think there's also a need inside the NFMHs, which I think part of this addressed, to beef up the care that they get while they're in the NFMH.
That's what leads to ability to discharge. So right. I didn't know if within the recommendation itself, like just a short inclusion of discussion of discharge be appropriate.
Sure.
Yeah, I think it does. This is Sandra again. I think it does, because I think that piece is missing, maybe in the rationale.
This is Representative Elizabeth Bishop again, and I seem to recall when we were going over this earlier that there was some discussion of supportive housing as a part of this, and so maybe some reference to that might be helpful.
And this is Carly at KHI Alpha. I think I see Hina on the line now. So Hina, I don't know if you were able to catch the end of the question, but essentially we're just wanting some more information, I think, on the connection between the items and measuring impact, and basically just how those ended up getting connected to this recommendation related to long-term care access and reform.
Sure. Hi, everyone. This is Hina Shah from KHI. The way that we approached the data profile and the measures was to look at each of the recommendations, and the state agency suggested what possible data is collected right now. So by no means is this the final ultimate measure you'd be using for the recommendation, but it gives you a starting point of here are some measures that are collected now or could possibly be collected that's done in the system now. And then if there are other measures that the working group thinks, they can think through it at that point. Because right now you just had initial recommendations. We haven't really talked about action plan at this point, and that's where the measures could come in. So when the next group kind of took this recommendation, they could say, okay, where's a point where we could start measuring impact? You know, what's a starting point? And that's essentially what these are. Does that help? Unfortunately, with our limited time with all of the working groups, we couldn't quite get to this piece of it with all of the working groups. And so that's why the state agencies worked in parallel, at least a representative from most of them worked in parallel to kind of put in some data points here for you to react to and have.
So this is Carly at KHI. With that additional information, maybe we pose the question to the group, do we feel, are these measures appropriate for what we were describing in this recommendation, or was there a disconnect there and we maybe need to trim some?
This is Sandra with United. I think there's a bit of a disconnect. When you're talking about discharge planning and using NFMHs in the continuum of care, I think part of what you want to measure is how many people are transitioned back to the community and how long their duration is in the community and their stability. Yes, the CCBHCs and the mobile crisis response stabilizations are part of what helps them stay in the community, but it really isn't a direct measure of that transition.
So what I'm hearing from the group is that maybe we remove these measuring impact statements and we consider this a recommendation where kind of when the next group or as people work to implement these recommendations, a piece of what the work needs to be is better defining how we can measure what the impact would be. Is that the decision that I'm hearing? Okay, seeing nodding there. So I'm going to strike through these. Okay. The other quick item, and I will say I have my eye on the clock here a little bit. The other item related to this recommendation that I want to flag for the group, throughout recommendations, we've attempted to clarify where the recommendation has made it clear who the action lead would be in terms of, you know, who would need to take first action. But then also throughout, we've been trying to pull out where possible kind of who the key stakeholders are. So basically, this recommendation should not move forward whenever it happens without input from X, Y, or Z entity. So we weren't able to pull those out from this recommendation. So would be happy to receive guidance from this group as to who we should list in that kind of key collaborator field.
Well, I would think KDHE would be a key collaborator as well. This is Andrea with KDADS. While KDADS is the action lead on NFMHs, I think anytime we're discussing, and while it's reform within NFMHs, reform of NFMHs includes an emphasis on care in the community. And so, you know, our partner KDHE would be an important piece of that.
Great, thank you. Okay, so just to summarize some of the changes that we've made here on recommendation 9.2, and again, Andrea, thank you for bringing us back to this one. I think these were very helpful clarifying edits to make. So we are going to add in the rationale the discussion of the discharge piece, as well as reference the discussion that happened around this recommendation around supportive housing. Additionally, the change that was made is we removed these measuring impact statements as maybe not quite appropriate, and we'll flag this recommendation as one where additional work needs to be done to identify which measures would best pair with this recommendation. Sound okay, or am I missing another change there?
Carly, this is Andrea with KDADS. And just to clarify for myself quickly, the items under measuring impact, those measures are part of we're only using, the report is only using those from the data profile metrics at the beginning, or it was any?
Any. So the data profile at the beginning was some of the higher level items to provide kind of a snapshot of how the behavioral health system is performing across a number of domains, or across kind of, you know, the many systems that kind of overlap in the behavioral health system. And then separately, the measuring impact are some of the measures that state agency representatives identified related to what was being discussed in the individual recommendation. So they are separate measures.
Okay, I just, in my mind, those got linked for a second. So I just wanted to clarify, thanks.
Andrea, this is Hina. There are places where the measure that's in the data profile might be under the recommendation as well. So you might have seen that, but it is exactly what Carly explained of a systemic assessment, but here's data that's being gathered by agencies under the recommendations. Okay. And so if anything got too in the weeds, it was more in the recommendations and left out of the data profile.
Very good. So this is Carly Houchin again from KHI. If we're good on that conversation, I'll move us maybe back down to the telehealth item, and we'll run through the recommendations here. And again, looking for any clarifying or corrective edits, primarily from those who participated in the telehealth subgroup, just so we can make sure we're not straying from the original intent of that group. So the first recommendation on page 50, if you're following along in your report, it's recommendation 10.1 related to quality assurance. Then we have recommendation 10.2 related to reimbursement codes. Recommendation 10.3 has to do with telehealth for crisis services. Recommendation 10.4 had to do with originating and distant sites. And recommendation 10.5 had to do with the child welfare system and telehealth. So we'll pause there and open it up across any of those 5 recommendations. If there's any clarifying or corrective edits that we should make, please feel free to toss those out.
This is Andrea with KDADS. And in regards to whenever we make note of privacy issues in HIPAA compliant platforms, also for the purpose of substance use disorder, mentioning the other federal regulation, 42 CFR Part 2, just that is it's a little different between mental health and substance use. And so just wanting to make sure that we note the importance of both, of being compliant with both regulations, not just HIPAA.
And can I have that regulation reference one more time?
42 CFR Part 2.
Great, thank you. We'll add that reference. Other comments? Okay, not hearing any. I'll kind of open it up one more time across the sections assigned to this group, or across the data profile or report overview that we've talked through so far in this meeting. Any final things that have come to mind, final changes that we should make before we consider our report ratified?
This is Andrea with KDADS again, and I can't put my finger on it specifically on the page that we're here, but I did notice there were a few points in the report, and this is just general language, that refer to rural and urban, or rural and wherever, and I do think that making sure to include the rural, frontier, urban, the whole spectrum whenever the report kind of discusses, different areas is important to make that, just to make sure that we're making that distinction between rural and frontier whenever that distinction is made as well.
Right. So. Thank you for that. The working group that met on Friday raised that issue as well. So the working draft that I have open on the screen, I've done a Control F throughout to try and add the frontier distinction each place where we have rural. But I'll make a note to flag that one more time to make sure we don't miss a reference there. Thank you for that, Andrea. Okay. I'm not hearing from anyone else. I think we can consider our report ratified then. With the changes that the group has proposed today, we'll go through and make those final tweaks. And then this group will receive the final draft of the report tomorrow afternoon, ahead of the special committee meetings that begin on Thursday. So we'll make the changes that this group has indicated, and we'll consider the report ratified, which means that the next steps for this group is presenting the product to the special committee. So to do this, I have essentially a two-step process and need to quickly run through some of our recommendations here to get some volunteers. But how I anticipate the special committee going is on Thursday, we'll begin the special committee here will hear topic by topic from each working group. And what I'll ask is that the co-chairs for each working group provide the initial overview of each of the sections, the topics assigned to their group. So about 10 minutes running through, for example, data systems, and then the legal system recommendations, and then the system transformation recommendations. From there, what will happen is will continue to be in the roundtable format of the prior special committee meetings. So from there, the legislative members of the special committee will likely ask clarifying questions about the recommendations to understand what the group has put forward. So what I would like to do is have working group member volunteers ready to speak to each of the recommendations that this group has developed. So there wouldn't be a requirement that you have a 2-minute spiel ready to go to make the initial pitch on a recommendation. Instead, we would ask that you just be prepared to jump in if there are questions related to that recommendation. So preparation might just look like going back to that page in the report ahead of the meeting and reviewing the rationale table to refresh your memory as to where the working group discussion had been on that, and making note of any additional related issues for yourself. So with that, what I might do is just run through each of the recommendation handles on the screen here and try to get to a volunteer related to each of them so that we have someone queued up ready to speak if there are initial questions. Again, anyone is welcome to weigh in throughout the process, but it's just sometimes helpful in some of those larger virtual meeting settings if we have someone queued up ready to be called upon.
Carly, this is Kyle. I would be happy to lead on 7.1 and 7.2.
Great. So 7.3 related to information sharing. Any other working group members on the call willing to be ready to jump in to answer questions related to those? I think we're also free to volunteer working group members who aren't available today. If you want to toss out any of their names, I'll reach out to them via email to try and get them queued up as well.
I can take that one, Carly. This is Sandra.
Okay, and 7.4 related to the statewide needs assessment.
This is Andrea. I can take that one.
Okay, and 7.5 cross-agency data.
I can take that one as well. This is Sandra.
Okay. Then we get under legal system and law enforcement. So 8.1 had to do with correctional employees.
This is Andrea, and I can, I will volunteer for that one since it's my umbrella,
Sure.
my bucket.
Great. So then recommendation 8.2 was from the supporter statement in regard to the Criminal Justice Reform Commission recommendations.
Actually, so Andrea again, and I'm happy. I would be happy to take 1, 2, and 3 here. I'm not particularly comfortable with crossover youth, so if there's someone else in the group that would take that, I would take the first out of first 3.
So 8.4 related to defining the crossover youth population. Anyone willing to be on call for that one?
This is Sandra. I can do that one.
Okay.
That's 8.4.
Okay, so then that takes us to the recommendations under the system transformation topic. First one being the regional model recommendation that we just spent some time on earlier in the meeting. Who'd like
This
to
is
toss their name into that
Kyle.
one?
I could do that one.
Okay. And 9.2, the long-term care access and reform.
This is Sandra. I can take that one.
Recommendation 9.3 related to integration.
And this is Kyle. I think if you wanted to put myself and Denise Sisman on that one, if she's available, then we could probably tag team that, or else if she's available, she could do that.
Great, I'll follow up with Denise on that one. Then recommendation 9.4 was related to evidence-based practices.
This is Andrea, and I can stand by for that one.
Okay. And then lastly was recommendation 9.5 related to family psychotherapy.
Is that the one related to 90846?
Yes.
I would be happy to do that with Sandra Berg right at my hip.
I got your back, Kyle.
Very good. So then I guess quickly, while we have a couple of minutes left before our endpoint here, Kyle and Andrea are our co-chairs. Any preferences as far as providing the initial kind of pretty brief, about 10-minute overview of each section between the 3 topics? Any preference among those for you two?
Do you mean a brief intro to each of the 3 topics, or an overview?
So I'm looking looking to divide up the 3 topics between the 2 of you, just to hear more voices in the meeting. So data systems, legal system transformation, dividing those 3 between the 2 of you, just to provide just the high level initial overview and brief summary of the vision statement we discussed at the top of the meeting too.
I'm happy to do system transformation, and it looks like Andrea has most of the legal system and law enforcement, and then we can figure out who we can either split data systems, or one of us could do it. I don't care.
That's fine with me. I'm comfortable with data systems and legal system and law enforcement. So
great. So I'll put our volunteer list down like that. Okay. Well, thank you, everyone. That takes us through the 2 kind of items we were looking to get through today. So we have a report with a few brief modifications that we're going to make, but otherwise I think is in really good shape, and want to definitely thank everyone for contributing your expertise both throughout the development of the report and helping us get to some of those final clarifying edits today, so that we can put forward something really straightforward and actionable for the special committee later in the week. So thank you so much, everyone. Again, we'll all be, I think, on the roundtable with the special committee on Thursday. So we'll talk very soon. But want to pause quickly before we adjourn just to see if there's any questions that I can address.
No questions. Just thank you for all your facilitation, Carly. You guys have done an outstanding job. Thank you.
Yeah, thank you so much. It's been a fun and very challenging, very complex project. So it's been a good one. Okay, so as far as next steps, you'll receive the final version of the report we moved through today, tomorrow afternoon. So for Andrea and Kyle, that'll be a helpful guidance document, I think, as you provide the initial overview related to each topic. And then for those who kind of volunteered to take questions related to specific recommendations, please feel free to use that as your guiding document as well. But with that,
Yeah, can I jump in 1 second?
Yeah, sorry.
Sorry. Andrea, you and Sandy brought up some good measures to think about. If there's others that as you are going through your section come to mind that you want to put into the report, please send them to me and we'll make sure we add them in, especially around that long-term care recommendation and a few others. So feel free to keep putting them in. Know that even though you're sending this in the working group report, this is still a working live document, right? So it'll change over time.
Very good. Yeah, helpful clarifying, as the data profile piece is something that will need to change and evolve as we learn what's going to work, and then get deeper into the work to see what will make sense there. Okay. If there are not final questions, then I will consider us adjourned. Thank you, everyone.